At the previous conference, I conducted a case study with a person who had fibromyalgia. And from there, we reached out to the Fibromyalgia Association of Asturias. They gave us the opportunity to have a control group and a slightly larger experimental group to conduct a more in-depth study. We decided to work with as large a sample as possible. It wasn't easy to find people willing to participate. And through this study, we aimed to see how full-body muscle electrostimulation could improve physical activity levels and, in this case, alleviate fibromyalgia symptoms. We all know what fibromyalgia is, but even today, there are doctors and places where it's not fully recognized yet. We know it's a chronic condition with flare-ups, and we wanted to see if this treatment using electrostimulation and physiotherapy could improve those levels. Electrostimulation offers numerous benefits for muscle activation and tone improvement. The main goal was to alleviate pain. The study aimed to evaluate acute and chronic pain in many cases, assess strength improvements, and analyze the subject's body composition. Fibromyalgia presents with a wide range of symptoms. Throughout the 10-week process, there was a reduction in pain levels, with most subjects in the experimental group experiencing a decrease in average pain intensity, indicating an apparent improvement and relief, which was also reflected in the surveys and the somewhat subjective evaluation of each participant. The electrostimulation work, which focuses heavily on isometric exercises, leads to significant improvements in strength. The training design consisted of a once-a-week, 25-minute session that combined cardiovascular activity, mainly cycling, with some static exercises. Then, very importantly, there were 10 minutes of endorphin boosting and pain relief exercises, followed by 5 minutes of stretching and muscle relaxation. After that, we conducted individual interviews to gather feedback and sensations, and participants described feelings of an endorphin rush, personal improvement, satisfaction from intense exercise, and the sensation of having accomplished a lot of training in a short time. Then some participants reported experiencing mild muscle soreness as time passed, though not everyone did. I'm still tired, but there's a significant improvement in pain levels within the first 24 to 48 hours. Then, well, if there is some fatigue, which is to be expected, people drink much more water, and there's also an increase in the need to urinate. You sleep much better, which is a very important aspect in terms of symptoms. Well, these are subjective assessments, right? Less stiffness, much more energy, improvements in strength and endurance, pain is significantly reduced, especially in the first 2 days. They feel better overall with psychological improvements as well. To conclude, we see improvements in both objective and subjective pain sensations, and increases in strength parameters are observed. Then, in the interview, there are subjective improvements at a general level from training with the electrostimulation vest. There are improvements in muscle mass, skeletal structure, and body composition. And there's also good adherence to the Mediterranean diet. And that's all. Thank you very much for the presentation.